And then community outreach and kind of just thinking through 2021. I know when Ray and I connected the other day, it's exciting to see some new things on the docket for the Alliance as we're expanding and growing membership and just considering new ways we can be engaging others in the across the state, as we all are kind of interested in just getting continued voice, broader voice from rural communities. So excited to hear Ray's updates on some of that new work in 21. And I think that's all we've got, and then adjourning. So excited to connect with you guys today. And I think I'm handing it over to Patrick and would love to hear what you've got to share about your work with the governor's group.
Yeah, and several of you, I mean, particularly the folks here may be well up to speed on this, so I won't go into a lot of detail, but Ray is sharing, he's put up on the screen, a document that's a really good, kind of a summary overview document of the membership. It lists the members of the council. There's about 40, and then there's some additional staff. I think this is a really smart approach at attempting to hit the reset button, and we'll see over time how effective it is. But I'm pretty impressed with the thought that's gone into trying to jumpstart some progress in this area. The staff to this particular council is coming from the Duke Margolis Center for Health Policy. As most of you probably know, the leader of that group was formerly a high-ranking official in the George W. Bush administration. So I think brings some real credibility and really sets the tone for the bipartisan nature of the group that the governor has put together. So we really appreciate that. There's about 10 legislators, and it's all really the key players that have been the key players over the past couple of sessions and still are. And they all participated entirely in the first meeting. We've met once. We will meet again tomorrow. Looking forward to that meeting. In the first meeting, there was really just kind of setting the groundwork and kind of getting the latest data information out there. Before the pandemic started, the number we were using on the number of North Carolinians that fell within the health coverage gap was 500,000, approximately 500,000 to 600,000. It's now estimated to be 1.2 million. So that is that's shocking and probably not surprising given the longevity of this crisis that we're in, that we're nowhere near the end of, but we do see some reasons to be optimistic in the months to come. The next meeting will be held tomorrow, and just to give you a sense of the topics that will be discussed, pretty impressive lineup for tomorrow. Part of the agenda will focus on the business community, and represented there will be North Carolina Retail Merchants Association, the North Carolina Chamber, a daycare operator, Lowe's companies, the hardware chain, and also a small business owner, Vivian Howard, restaurateur from Kinston. Additional coverage considerations is the second topic, kind of to look at things beyond, additional considerations beyond expansion of Medicaid. And so NC Medicaid will be part of that portion of the agenda. The Locke Foundation is doing a presentation, and Georgetown University also coming. Third big topic on the agenda is mental health options for closing the coverage gap with respect to behavioral health care. There'll be presentations from DHHS, Coastal Horizons Center, and Atrium Health. A number of the people presenting tomorrow are also represented or have seats on the council. So that would include Lowe's Hardware, the North Carolina Chamber, Atrium Health, and I may be overlooking somebody, but at a minimum, those folks have seats on the council. It's thought that the council will meet about 4 times, so there's 2 meetings lined up for the future, and I think that's down maybe on this document, Ray. And I believe the next meeting, January 8th, which is a Friday, and also January 22nd. Both meetings are on Friday. These meetings are recorded. The presentations and contents available to the public. You can sign up to sit in on. It is an open meeting, so you can sign up to actually listen in and participate. But that's a good overview. Just a couple of things on the first meeting presentations. There was an excellent presentation out of Ohio on what has been their experience, what was both their experience in the debate on whether to expand Medicaid and what has actually happened since. Pretty good story to tell and pretty darn relevant to North Carolina. There's a lot of, that's a good comparison state for North Carolina for a lot of reasons. Second presentation, Mark Holmes did an excellent job of really reviewing the state of things for the entire state, but he did a particularly good job at really drilling down on rural North Carolina. There are a number of rural North Carolina almost exclusive viewpoints on the council. I'm very glad that they invited the Rural Center to participate, but we've got a Methodist minister that's really led on this issue from Richmond County. We've got the chairman of the Board of County Commissioners out in Graham County, and some other voices from around the state that really bring the rural perspective to the table. At the end of the meeting, the legislators did talk a lot, and they responded to what they heard, expressed some criticism, but in soft, polite ways that they did not want the council to only focus on Medicaid expansion. And so that's where they really pushed to hear these additional considerations that we will hear some of tomorrow. So I'll quit, and I'm excited about this. I'm hopeful about this. It's not going to be an easy job to kind of push the reset button, but we can't afford to go a lot longer without without really taking some significant steps to close this gap.
So quick question, Patrick. Is Dale Wiggins on the, okay.
Yes.
Because I know that they were, Dave had reached out to get his contact information. I worked back through Becky and Sophia. So I just wanted to make sure that happened.
He is there and he is fully participating.
I love Dale. He's great.
I love him too.
Yeah.
And he's a great case study. That county's a great case study, kind of the process they went through in getting their Board of Commissioners there. If you can do that in Graham County and get them to absolute consensus on Medicaid expansion, there is no excuse for anybody else.
Well, that's
doable.
That's awesome. And so the other question I had, do you think that, because we're working on another issue around migrant farm workers,
yeah,
but Josh Dobson as the labor, I don't know if they're going to look at bringing him in.
Oh,
but
that
I
would
think
be a great addition for several reasons. One, I don't think currently the Department of Labor has not been that helpful in efforts to address the migrant, not even migrant, but just the farm worker situation that you're dealing with. And Josh would be a total asset, I think, in that conversation. And just given his past history, he's pretty comfortable with this issue, and I'd love to see him added to the council.
Yeah, I just thought, because he was such a proponent of this, it'd be, I hope, and
One other thing I wonder about, and I'm not, there's so many people on the council, and we've not spent a lot of time together. But I wonder if the Latinx representation is as strong as we would like. Is it really ought to be, to your point about, there's some real reasons that population should be well represented.
Mm-hmm.
Well,
Okay.
I will say that I heard Matt Gross talk about the council recently, and he did say he didn't think they were looking to add any additional people to the current construction of the council. So,
Okay.
Well, it is pretty big at 40, or
Yeah.
around 40, maybe 38 to 40. I get that. I understand that.
Yeah. Well,
So-
go ahead. I'm sorry. Go ahead, Randy.
Well, Patrick, I'm just so thankful that you're there. And sort of on the thread of conversation that Ray mentioned, there are a number of groups that have said, what about us? Could we be there too? And, notably for me and Brendan would be, there are not any safety net primary care
Right.
providers on the panel, except
So,
for maybe Lisa Harrison at Granville Vance, and I respect that. And so I'll just get it out and then you can comment, but I'm not really lobbying for a slot. And I thought if there was one, Chris Shank would be the choice because FQHCs represent most of our group. But what might be of interest to you and help you in the conversation, particularly tomorrow, is before Ben Money jumped over to DHHS, he and I and some others were meeting with the John Locke Foundation to talk about sort of these alternative ways of handling the uninsured other than
yes.
Medicaid expansion. And so you'll probably hear them raise the topic of direct primary care there. And, that's, it's an interesting idea. It's one that we're exploring, and it actually could work for self-insured employers, as a sort of a non-insurance product. So I wanted you to be aware of that. And then the other thing that caught my attention when I listened to most of the meeting was Senator Craywick. The number she quoted was 600,000, I think, on the uninsured. I might have gotten it wrong, but the 1.2 million that's in the summary, there's also a 1.3 million number that shows up in the Healthy North Carolina 2030 report from NCIOM.
Okay.
And just in my work over the last 4 years, we just have seemingly incapable of coming down on a single number.
I know.
Who are we trying to fix here? I was encouraged by your 1.2 million, but I know it's more than 600,000.
Oh, absolutely. No question about it. A couple of things. First of all, if Brendan or Randy or anybody else on the call, if you have any suggestions for like questions you would want me to ask, or shoot them to me, send me an email and tell me, particularly along the line of what the Locke Foundation may be presented, because a lot of the Republican legislators, I mean, the first thing out of the box, and I get it, and I want to hear what the Locke Foundation has to say. But we know where they come down on Medicaid expansion, and they want to rule that out. And I have yet to see anything that significantly, there's nothing comparable that I know of that would make a dent in the number we're talking about, whether it's 600,000 or 1.3 million. And so I would like to be equipped to ask them, just to press them quite genuinely in trying to understand more of where they're coming from, because I think we have a real responsibility to put forth solutions that actually are equal to the challenge. And that's going to be one of my goals. The other thing that they've asked specifically for members of the council to recommend other presenters or other areas that we ought to be looking at. And I will specifically recommend that we should be hearing from the safety net providers, because you all are taking up so much of the pain and the pressure and everything else that's on the system. This needs to be factored in.
About 500,000, what they would call covered lives, although it's not coverage. About 500,000 people are being taken care of between Lynette's old affiliation with local health departments, Brendan's work, ours, Maggie's work with rural health clinics and school-based health centers. It's really remarkable. And it's a 100-county strategy when you look at us all together. So,
okay. I will definitely bring that forth. Maybe we can, I can convince them to do something for the third meeting in January.
Great, thank you.
Yeah.
I really appreciate that, Patrick. And I've bounced around an idea. I think I've had similar conversations with Matt Gross as other folks here probably have, which was, how do we get on? How do we get on? And, they're not trying to add anybody, which I understand for a lot of reasons.
Yeah.
So I'll send you Andy, an idea of talking about the safety net, because I've got some ideas for like what might be a good hook to talk about the existing supply to care for the folks who'd be gaining coverage.
Yeah.
The other thing I wanted to send, and I'll send this in writing to you, Patrick.
Okay.
I think your question is exactly right, or what you're hoping to ask of the Locke Foundation is, most of their reforms that they talk about are not coverage related, or they're marginally, tangentially coverage related, right? They're about things that might reduce costs or might address the provider supply, but
or work for some subset of folks.
Yes, and I think there's one big one that I think Senator Kropick, I think, may need some updated data on, which is association health plans.
Yes, that comes up a lot.
Yes, yeah. And you guys know from my past work, I have a heavy cross that I was bearing on those, but not as much a priority of mine now from the Community Health Center Association. But I mean, the key thing is what the Congressional Budget Office has shown is the folks who would enroll in these plans are already insured. So they're basically switching. This isn't really helping people who are uninsured get coverage. I think they said 10% of those who would enroll in association health plans would have been previously uninsured. So
that actually makes a lot of sense.
Right. Yeah. So, like folks who already have small business coverage, maybe finding some more affordable options because there are fewer benefits required and things like that, or there's some premium rating rules they can skirt around. And you can debate the merits of that, but it is not an analog for Medicaid expansion. It's not helping the same folks. So,
if you have anything along those lines that you could just send me to help educate me a little bit, I would greatly appreciate it.
Will do. I'll send something to you today.
But I follow your line of, the line of reasoning. That makes perfect sense.
Yeah.
And I just think we're at a point where we can't let the opponents of Medicaid expansion off the hook for if that's not a road they are ever going to go down, then there seems to me some responsibility for them to put forth the road that will get us to the same place. And I don't believe it exists.
Completely agree.
Absolutely.
Patrick, I just sent to Ray a document from the Governor's Advisory Council on Aging, some recommendations, and I've asked Ray to send that out to everyone. It just was released, I think, last week with 4 or 5 points on some recommendations. And so the recommendation, the report went to the governor, of course, and to Secretary Cohen. So Maggie, you'll get a copy if you haven't seen it.
Great, yeah.
And of course, I'm very pleased to see the first priority bullet without us even advocating was the expansion of PACE.
Yeah.
So you'll read that and see that in there, but that might be helpful as well.
Okay, thank you.
One more question, this time of Maggie, because, as I think about this stuff, when you put together the community health grant funding, which is quite substantial, 15 million a year, and you put together the 25 million plus that has been given to our association and Brendan's, and then a bunch of others.
Yeah.
In essence, the state of North Carolina is paying for primary care and other kinds of care for the uninsured and opening the portal, right, Maggie? The portal is another big one.
Right.
So there are forays of the state with its current lineup of conservative viewpoints that is already stepping into this space. And so, it's a big thought, but I just wondered whether the Alliance might be a place where we could put together the big thought of we're almost there anyway. Not with all the dollars, but the conceptual place of, yeah. And so when you combine it with the governor's executive order on communities of color and health disparities and all that, I mean, we're going there. Why don't we just do it thoughtfully? It would be
instead of inadvertently. Yeah.
Yeah, there you go.
Yeah.
So one thing I wonder, Randy, and I think we've all kind of had this in the back of our minds, right? Is if there's Medicaid expansion, then do you think that they'd still fund community health at the amount that they fund? And I'm not saying that's good or bad. I'm just saying
That's a great question.
that's yeah, it's just one of those things. So are you saying, would the legislature, okay, well, if we're going to do this, are we going to change the way we do that?
Yeah.
And I'm not saying I know the answer to that. It's just a question that I think they should do both,
Right.
but
we tend to
but
be
if you
cheap.
open up the discussion and you move that way. Sense?
Yeah.
You're kind of freezing on us, Maggie, but it's a really good thought, but it relates to the inability to come down on the number, because the truth is, if you add the 285,000 or 385,000 or whatever Medicaid expansion would do, if you believe the number is 1.3 million, there's still what, 750,000 people that we've got to care for. So there's no argument for taking away the safety net supports that are already there. So it's that's my anxiety, Patrick, about there not being, a safety net person there to make those points. But it's also why I'm very thankful you're there to help out.
Well, I'll try to fix that, because I do think the argument you just laid out, and Brendan, what you added, this needs to be heard by everybody on it. This needs to be part of the record of this council's deliberations.
And like I said, Patrick, I am certainly not disputing, Randy, the point you were trying to make. I'm just always kind of cognizant of that as well. So it should be both, not or.
Yeah, and Brendan, I understand your point too. It gets measured in different ways, resulting in different numbers, with everybody not using the same definition for what they're measuring.
Exactly. Yeah. So that just gets a little messy. I just wanted to highlight that, because sometimes we talk about the coverage gap, but that's a subset of the Medicaid expansion population, which is a subset of the total uninsured, et cetera, et cetera.
Yeah.
Thank you so much for that update, Patrick. And it sounds like a number of us can send you some items and questions in preparation. You said the next meeting is tomorrow?
Tomorrow morning.
What time? Okay, tomorrow morning.
Let me see what time it begins.
I know I'll certainly reach out to my team and see if they're sharing anything with Steve to speak in response to the John Locke Foundation. We've obviously, had to speak to a number of issues with them regarding CON and other things.
It's from 10 until 12:30.
Okay. Thank you.
In the newsletter, the Rural Health newsletter that went out on Friday, I guess last week, there was a link to the live stream that was included in the state updates.
Yeah.
So if you still have that, you can get the link there. But if you need it, just let me know and I can send it to you as well.
That's right. Well, I think next on the agenda is a lot of Ray updates about membership and the work groups. So take it away.
Emily, if I could say one thing before Ray gets started, I'm gonna stay a few more minutes. We've got actually two things going on simultaneously, this and a small business task force that we're coordinating. And I need to be back there by 11:45 or Brandy will kill me.
We don't want you to have to answer to Brandy. That sounds serious. Thanks for being here this morning, Patrick.
Yeah, you're very welcome.
Thanks, Patrick, and thanks, Emily. So yeah, just want to give a couple of quick updates and then get some thoughts on some things as we look forward to 2021. Look really forward to 2021. But The membership drive, as Emily just referenced, was able to put some new language up on our webpage that has the link to the new membership form. The information about the new membership model did go out at the top of the last Rural Health Leadership Alliance newsletter. And then when we come back from our break, the week of January 4th, we have an email that I worked with our communications director that will be going out soliciting membership. So we've been doing a lot of work behind the scenes on that. We've got a couple different social media posts that are in reference to the new membership model and how to get folks to join. So we will certainly keep you updated as we move forward with that. But really excited to see where this takes us and how folks respond to it. And then, of course, going along with the membership meeting or the membership drive is the membership meeting dates. I had sent out an email to folks about the quarterly membership meetings. Did get some feedback from some folks that maybe those dates weren't the best for everybody. So, and it was split about 50-50, you know, half the people, yeah, these dates are fine. The other half, not so good. What I wanted to check with folks for those quarterly membership meetings, as I said, outside of the February 19th one, which is set, and we don't have any maneuverability with that. The other three, for May, August, and November, we do have some flexibility. And I wanted to see if maybe if we push those back 1 week, so that would be May 21st, August 20th, and November 5th. Or I'm sorry, May 21st and August 20th. And then the November one, we would actually move forward, because if we push it back, then we're into Thanksgiving. But so if we move that one forward to November 5th, just wanted to hear if folks had any thoughts if those dates worked.
They're open on my calendar, but so were the others, so I'm fine.
Good.
Yeah.
As one of the squeaky wheels, those dates appear to be good on my calendar.
Perfect. And Emily, Maggie, Lynette.
Yeah, they're okay on mine as well.
Perfect. Okay, so I will send that out. I will send a calendar invite following our meeting today to get it on everybody's calendars. The other thing that I wanted to ask about were the steering committee meetings. They are currently set for the third Thursday of every month at 11. Are we good with continuing third Thursday of every month at 11? Or
Yeah.
Fine with me.
perfect. All right, I will do that as well. That was easy. I like that. All righty. So now we get to talk about some really exciting things. Some of the work that's been going on in the work groups. So, you know, when I came on board, there were 1, 2, 3, 4, 5 work groups that had been identified. And so that was the Access to Healthcare work group, the Social Determinants of Health, Snapshot report, behavioral health, and the disaster response. So, you know, we haven't had movement at all with the behavioral health and the disaster response. I think the behavioral health work group was thought up and was to be work that we did around a joint grant with our Center of Excellence, another FHLI program. Those grants have fallen through. So the work that we thought we were going to be doing, we just haven't gotten started with yet. I just wanted to put that out there. And then the disaster response work has really been picked up by the Insider group, which is a disaster response and recovery group that's been meeting through the Rural Forward North Carolina program. So some of the reasons why we haven't seen any of that, but some updates around some of those other work groups. One is the Snapshot, and I am happy to say that we have our draft of the North Carolina Rural Snapshot report. Wanted to quickly scroll through this just so you can get a sense, but for some context, really quickly, this is something that we're going to use to draw attention, of course, to the issues of rural health in North Carolina. Use it as a tool to educate the general public and our legislators to the specific issues that our rural citizens are facing here across the state. So here's the content. So how we have it broken down outside of some of the administrative stuff, the first 5 pages, the measures you can see here. We've got general demographics, population, education, income, poverty, and food access, and then some of the overall health information. And then finally, some healthcare infrastructure regarding the safety net and workforce recruitment and hospital sustainability. Yeah, we can go through all this, all the wonderful information that we need. Let me get this out of the way. All right. A little bit of talk about our health indicators. The county map. This is our county typology, which we adopted from the Rural Center and our work with Jason. So this sort of lays it out, you know, how all the measures work. The regional and suburban, or the suburban counties and the urban counties are all considered urban in this typology. So we've got the 80 rural and then the 20 urban. The demographics. So a little bit of information about each of the different topics here. General population, we've got some veteran information. And again, I'm going to go through this really quickly just to give you an idea. Education, our rank among per pupil spending, rural residents with post-secondary education, that sort of stuff. We've got some ACE information here. Income poverty, rural versus urban, below the poverty line, rural median household income by race, some food access issues.
Hey, Ray, could you scroll down just to page 11 again?
Page 11, yes.
I was just looking at, all right, so stop right there. Great. Okay, because I was just trying to think about the atlas, the social determinants of health atlas that the state has. It kind of overlays. You can look at specific counties and so on with all this information. It's probably in here somewhere, but I was just checking that link to see if that was it, but it doesn't look like it is. But you can go county by county and look at all those different layers of things.
Mm-hmm.
I'll put it in the chat.
Okay. Access to care. So we still have a couple of outstanding things that we were hoping to get from the SHEP Center, but haven't received them as of yet. And one is around healthcare coverage rates, rural versus urban, and then the various payer mix, private insurance, Medicaid, Medicare, that sort of thing, uninsured. Trying to get a look at that. If we don't get those measures, we're going to have to take this page out. If anybody happens to have those measures or know where we might be able to get them, or has some particular influence with Mark over at the SHEP Center, please reach out and let me know.
I can see what we can pull, Ray. We've typically gotten a number of those more updated, I think, from the SHEP Center, but I can see what we can pull.
Okay, that sounds great. Thank you.
Ray, just out of curiosity, not to get too deep into the weeds, but are you looking, when you define the population, are you looking at counties, so like rural designated counties, and taking some sort of average of the uninsured rates across those? Because I would think those are easy enough to pull from the American Community Survey, probably the most recent 5-year release that they did, and the census.
For the coverage that you're talking about up here?
Yes, sir. Yeah.
I'm sorry, could you repeat that again?
Sure.
I heard you right.
No, sure. So I was thinking right here, when you're trying to look at coverage rates and you're saying rural versus urban, are you trying to average it out by county? So basically take an aggregate average of rural counties rather than getting down to the zip code level.
Correct. Yes.
Okay.
Yes, sir. Yep.
I'm not doing this work, so this is only worth whatever it might be. But I think this should be easy enough to pull through the American Fact Finder, which is the data hub for the American Community Survey that the census does, and it's usually one of the gold standards for coverage rates and uninsured rates. You'd have to do a little bit of data analysis, but it's stuff that I could do. I'm not a data person, and I think there should be something that's easy enough for someone who is not quantitatively analytically inclined, as I am not, to pull up. So I can send that to you if it's helpful.
Yeah, that would be great. Yeah, thank you.
I guess I also wonder, the North Carolina Medical Journal recently did an update on the ACA, and Pam Silberman, who has been really, really involved in kind of tracking those numbers, she would be another person who would, I think, be really helpful in talking about the rates of insured, uninsured, kind of breaking that down. I just went ahead and put the link in the chat, and she has, there's a scatter plot graph that's in there that kind of lays out the number of uninsured, unemployment rate growth, and Medicaid enrollment growth. So that may be the other place that could really assist you in sort of coming up with some of those numbers.
Okay, great. Thank you.
There's a figure 2 in there too that shows estimated increase in uninsured rates, and there's a map. So
okay,
that may be helpful.
Yeah, and I think they probably draw from the same source when at NCIOM, because I think even county detail was available on this stat when we were doing the Healthy North Carolina 2030 stuff. So
okay.
Another vote for Kathy Colville.
And we've got some workforce information here. Behavioral health, rural youth, and suicides. All of this is going to be about the same. And on the side here, we do have some additional measures. Fluoridated community water access, that sort of thing. Kids entering kindergarten with active dental decay. And then the same thing around substance use disorders. And then our healthcare infrastructure with the rural safety net and So all of this, I'm showing you here. One, just to show you, hey, we finally are getting somewhere with this. I know this report has been something that's been talked about for quite some time. So very excited to see this starting to be rolled out. But a couple of specific questions that I have around that report. One is, we are, of course, in need of some reviewers, looking for 3 or 4 people to sort of go through it, make sure it makes sense, make sure it reads well. If anything happens to jump out at you, just an extra set of eyes as we go through the draft process. And wanted to see if we had any volunteers that would be willing to give it a once over. It's a pretty quick read, as you can see. There's nothing too outrageous that's in there. But have any takers, or do I need to send this out in a broader email to the other 4 or 5 people on the steering committee that aren't with us today?
So I think our office, I'm going to say, could do a review. And Ray, I feel like I let you down on getting some of this data and so on. We kind of gave you sources, but not really, as much help as I think we could have been. And I apologize for that. So yeah, I think internally we can make sure people take a look at it. I think what I will do is I would have the managers in the office, because I want them, number one, to be aware of it, and number two, to provide some feedback. So
Okay.
that'd be great. I really appreciate it.
Perfect.
I'm willing to help you too. I find, because of my law degree, I get called to do this all the time, so I'm kind of used to doing it.
Ray, what is the timeline for this review?
We've got, we are looking to publish this sometime towards the end of January to mid-February, to sort of coincide with when the General Assembly comes back and starts working in full force. So, over the next, 2.5 weeks or so, I would think. And I know part of that is the holiday week when a lot of people are off. So.
I've got a quick question, Ray. I know this is part of, because I was on the small group putting some of this together, but I know Jason Gray, I'm not volunteering him, he's not like part of this group, but I know he had some very specific thoughts around how rural messaging and data is shared. And yes. I don't know if he would, I'm sure you've already got him in mind, but maybe targeting outreach to him to see if now he can kind of look at it and get his thoughts.
I was gonna ask Patrick if, he could do that. Yeah.
Oh, great.
So I think between, and I feel quite confident somebody from the Rural Center will be able to review it. So between, ORH, Rural Center, and Randy and his law degree, I think we're good.
I'm sad that Carla's not here, because this is almost celebratory with her push for this for more than a year. Maybe you can pass along our congratulations to her.
Absolutely.
Yeah. This has really been her baby, and I promised her it was something I would get done for her. So.
Who did the design and layout work? Did you guys do that in-house?
Yes. Yep.
It looks great.
Director. Oh, good.
Yeah.
Thank you.
Yeah, it looks great.
Yep. We wanted to make sure it was a quick and easy read. So, thank you. All right. So the other thing I wanted to get your thoughts on, one of the things that we feel is probably missing from the report is something about COVID. I mean, can you put out a report about 2020 without mentioning COVID? I don't know if that's the case. If we need to add something with COVID, and something tells me I think we kind of do. What would that look like? Does anybody have any thoughts on some good measures, right? No good measures with COVID, but some thoughts for some data that we would or should consider including?
Tracking, as an example, suspected COVID-19 cases that are tested. We then track confirmed COVID-19 cases. This is on a per clinic basis, so I guess you could do it by county, maybe. And then we're tracking deaths. No, well, it wouldn't work for you. We're tracking new patients. So you wouldn't need that one, but
yeah, and
example.
Part of the issue is that these numbers are changing daily and they're changing dramatically. So I mean, might it be, rather than including measures, we include just some narrative around the impact of COVID, particularly as it relates to rural health?
And we can certainly, go ahead, Maggie.
Oh, go ahead, Emily.
Well, I was just going to mention the narrative piece. I don't know if there's a story to be told around the higher likelihood of someone to be hospitalized with COVID in a rural community, maybe versus another community, but and pulling some of that from the DHHS dashboard, which I think might be what Maggie was sharing there.
And it seems to me too that if you look at the narrative that NRHA has also created around a rural story, that you could modify some of that, and then you add, now that we have these county level dashboards, you know, as a way of tracking that over time, that, you know, that would be a really, and if this is an electronic document, then of course, if they click on those county dashboards and things, you can see that.
Mm-hmm. Bye, Lynette. Thank you. Yeah, I know we're getting.
Happy holidays, Lynette.
Okay.
Yeah, Ray, just a comment. I think your intuition is right. That narrative is going to be really important just because of the frequency with which these data are changing. I think it's useful maybe to highlight. You could take some point in time trends or total figures that are broken down by county thus far, but I'm not sure how much additional analysis you want to do with those data. So anyway, that's just a tally in favor of additional qualifiers about what we already know, what some folks have already said, like underlying risk factors for severe illness and things like that we know are associated with virality.
And I don't know, Ray, if it'll come up, but vaccine adoption rate in urban versus rural, that's something that we're really paying attention to.
Okay.
So I think you bring up a really good point, Ray. Thanks for that.
Perfect. All right, and I know we've only got 5 minutes left, and I'm gonna roll through some of this. I would like to try and collect some ideas for 2021. Some of the things that we've got planned. We've got some funding to do some webinars. The Rural Health Leadership Alliance, I'm going to be producing a monthly 30-minute podcast about rural health in North Carolina to help sort of increase awareness and inform discussion and expand dialogue around some of those important issues. for rural health stakeholders. Wanted to hear if anybody had any ideas on topics or potential speakers for both that webinar series, which is going to be every other month. It's going to be like a 1-hour webinar, or for those monthly podcasts. Anybody that is a must-have speaker or presenter or a must-have topic?
I think it would be great to consider some of our, I mean, I'm just thinking the hospital, rural hospital leaders who maybe have had to rethink, I mean, thinking COVID, rethink the way they're serving their communities or working with their communities. I know that Shakira McCoy, our Rural Health Innovations Manager, is kind of constantly learning about new practices or new ways they're looking at again, serving their communities. So she might be able to know, you know, here's a couple that might be rise to the top that would be good to feature. And I know, again, First Health Montgomery is doing some innovative work around remodeling how they're serving their communities as well and remodeling their healthcare facility. They're probably a little further along in that than they were at of course, the beginning of this year. I don't know how that's shifted a little bit based on COVID, but they might be a good one to include.
The other thing I was just thinking about, Ray, is the community health worker initiative, because we're very lucky that we got 6 months of additional funding to go from January through June. So that's really exciting. I think the support services, we've had a lot of really good take, I think, in rural communities. I think there was a real desire for us to go statewide, but there's only so much resource available. But I think some of those stories of the community health workers and the support services vendors that are out there who are able to provide that level of support for people who have been affected by COVID, and it goes anything from paying somebody's rent to paying their electric bill to giving them food boxes. I think that would be a really powerful presentation. People who are on the ground actually doing the work.
Be in a separate conversation, as you know better than anyone, we've struggled to find traction on the health access story, the health access work group, but I'm kind of inspired by today's conversation with Patrick that maybe there's a theme in the moment for us there about, how we be sure that everyone has care in the interim while we're trying to be sure everyone has coverage. And that this podcast webinar idea might give us a reason to compile some materials that would be useful in those discussions as well. So we could take that offline.
Okay, that sounds great. Good. And, maybe the next time you're in the shower and you get hit with that, creative light bulb about, oh, Ray's podcast idea, don't be shy about jotting it down and shooting me an email. So.
Awesome sauce, as Betsy Tilson would say.
So,
happy holidays, everybody. I got to jump, and great work.
Thank you.
Thanmes, everybody.
Bye. Thanks.
Yeah.
And it is 11:59. I do have one really quick question. Does anybody know of any other organizations that may be considering applying for the chart model grant? Of anybody?
I know that Shakira has been part of conversations with Maggie. Actually, Maggie, the ORH has been very interested, of course, in learning more about the chart model. And I think there were 1 or 2 hospitals that were considering. I think some of them were part of HCA in the western part of the state. I don't know where the recent conversations are now, but I can certainly find out from Shakira if you're wanting to kind of connect with them. And
I was just being curious for somebody else. So,
Yeah,
and
that
I
was the
know
one.
there's, yeah, some talk with folks at Mayhec. I don't know if that's the same crew but.
Yeah, possibly. If it's Mayhec, then I'm guessing that that was something they were exploring together with HCA in some way, but I don't know the details of it, but.
No, thank you.
Yeah.
Bye,
All right,
Randy.
we'll see you. Thank you.
Happy holidays.
All right. Yeah, it's 12:01. Yeah.
Been quite a
Happy
year.
holidays, everybody. Thank you.
Thanks, guys.
Bye, guys. Thank you.
See y'all. Huh.